Respected Vice Chancellor, professors, deans, friends, students, a very good day to everyone. Today's topic is about selection of a research topic. And whenever I talk anything on academics, I put a big salute to the legendary teacher of 2 centuries, Professor Ravi Shankar, who is currently the Director of E-Learning. What are the objectives of this session? Why do you want this session at all? Identification of a research problem, a research topic selection, and writing a title. This is what is the objectives of this, probable objectives of this session or my talk like. So there is something called single loop learning, double loop learning, and triple loop learning. This is about what, and this is about how, and this is about why. So this is single loop, double loop, and triple loop learnings. Now we have this is not actually learning. I'm telling about first, second, and third loops. Now this is a fellow who puts up a racket to the girlfriend in the school. So we know the outcome. Yes, we get this fellow to the headmaster room. Okay, you should not do that, and go back and start reading. This is what outcome we are doing something. And the second loop is, okay, go and talk with the parents, convince him that he can read. And then the third is, okay, make a conformational change in the school, make a transformation in the school so that these things are decreased. So if you go on to medical, now if we have a hypoxia, patient with hypoxia, because he has got a pneumonia, because he has aspirated after an alcohol injection. Now, if we give oxygen, yes, okay, the patient will become white. Now, but how did he develop hypoxia? This is second loop, and he go on to research on how he develops hypoxia because of the pneumonia. Can we correct pneumonia? All these things make up double loop. And if you go on to make a transformational change so that alcoholics don't go into unconsciousness, don't go into the level of that where they can aspirate and they land up in pneumonia. So this is what they call as first loop learning, second loop learning, and third loop learning is what, how, and why. We will start with why now. So properly formulating and defining the research. So why do you want to first formulate and define a research? Because we can choose the appropriate research strategy, appropriate data collection, appropriate analysis techniques. Now we have a research work. What did we do was, after normal delivery, we asked the patient how much the pain was there during labor after 6 to 8 hours. Now the delivery has taken place at 1 p.m. We asked the patient how was the delivery pain at some 7 p.m. And we all noted down how much was the age of the baby, how much of the age of the patient, weight of the patient, weight of the baby. Was there any oxytocin drugs, stimulating drugs used? Was there any pain relief used? There was so much of data. Because we did not formulate and define a research topic, the appropriate data collection was not there, and we could not analyze. Like at last we came to a conclusion to analyze as logistic regression analysis and published it, but we landed up in problem because we did not formulate and define a research. Now we may need to understand certain things. What is a research problem? What is a research topic? What is the purpose of the study? And what are the research questions? The research problem is a general issue, concern, or a controversy addressed in research. Topic is, what is the topic like? We are going to deal with this. What is the purpose of the study? I am going to prove that yoga is efficient in hypertension. That is the purpose of my study. What is the question? The specific questions the researcher would like to answer. Naman. Because now we are going to give 15 days of yoga therapy means the BP is likely to become better. The autonomic imbalance is likely to become more regulated. This is a research question. So this is a research problem, topic, and these are all the other things. Now we will go to the research problem. What are the sources of research problem? From where? Yes, we know that we have to know what is the research problem. How to know it? Yes, professional experience. By the way, I am 30 years in this field. I've got a rich professional experience to identify a research problem. Professional literature. You go into the Indian Journal of Medical Research, Indian Journal of Clinical Research, International Journal of some tropical diseases. So professional literature. Academic discussion. Whenever you discuss with your friends or your seniors or your senior academic professors, also discuss about the research problem. Yes, what is the research problem? Do you think is okay? Situational needs. We cannot go on researching about what is all not needed, something like diphtheria, like that. So COVID-19 is relatively a situational need. Now we want to narrow down the topic. You see here, this is COVID-19 pandemic. This is prophylaxis. This is drug. And this is adjuvant drugs. And here is the drug therapy. And then we can see this immunological, pathological, preventive, social, all factors here. So this is what is the pandemic, this thing. Now you see, this is the problem. COVID-19 is a problem. An area of research are so many: clinical research, immunological research, pathological research, microbiological, social research, so many things, medical research, psychiatric research in this corona. Now we have drug therapy, yes. We have adjuvant drugs, yes. Yes, prevention. Now this is problem, this is area of research, and this is topic. Now what I want to now you see is, this is what is called Mandel's paint. This is betadine or povidone with glycerin. And if you apply in the throat, just you can prevent this corona. This is what I want to prove like. So the problem is corona. The area of research is somewhat pathological or microbiological, we can say. And the topic is about prophylaxis of corona. That is Mandel's paint. This is how we have to narrow down the topic. Now, if we take some more example, this is non-alcoholic fatty liver disease. Every male fellow will go slightly obese, you do a scan, abdominal pain, he becomes fatty liver. So, non-alcoholic steatohepatitis, NASH, or non-alcoholic fatty liver disease, NALFLD, is not an alcoholic. It's a big problem coming now. So this is a big problem. Now, what is the area of research? High cholesterol is associated, level of triglycerides, incidence of metabolic syndrome, obesity, PCOD, sleep apnea. The patient goes to apnea during sleeps. Sugar, thyroid, hypopituitarism. So many areas of research we can link with NFADs. Now I am going to take sleep apnea and NAFLD. So this is how you address a problem. You have an area of research and you narrow down to your topic. So this is about a research problem. What we have is, now we go to research topic. What? Now we have done why of it. Now we are going to what of it. To generate ideas that will help in the choice of a suitable research topic. We have to generate ideas. It has to come from us, or it has to be coming from some other else, and we have to listen from them. To identify the attributes of a good research topic. Yes, I have got a research topic. For example, I want to know something about pituitary gland tumor and immunology, something like that. Attributes of a good, yes, these things are okay. To turn research ideas into research projects that has got clear questions and objectives. Now I told application of Mandel's paint in the throat will decrease the incidence of corona. That is what I told. Now this is a research idea, but how are you going to convert into a research project? Now you are going to select patients with corona. You are going to take an oral swab. You are going to measure the viral load, and then you are going to apply. You are going to apply either Mandel's paint or a placebo drug, which has got no drug. Then after some 5 hours or 24 hours, you are going to take again this. This is what is called turning research idea into a research project with questions and objectives with a clear design and methodology. Then you have to draft a title, generate ideas, this is out where, why, what, and how. Brainstorm for ideas, search literature you have to search, discuss with your supervisor and guide. That is very important. Your guide may not be interested in yoga and you go on pestering that you should do yoga. No, guide is also interested in certain topics. That should be always taken into account. Make a list of questions for which you want to find answers. Now in medical field or in biological field or in social field or in epidemiological field, wherever it is, I want to know. Now that, for example, we thought the childhood obesity was around 10%, 30% and all. We did a sample survey of 2,200 students in childhood, where we found only one less than 2%. So make a list of questions. I had the question, what is the incidence of obesity, for which you want to answers. That was published as Kumbakonam Urban Urological Epidemiological Study, Cures 1. Be flexible. That is very important, because I want to be very important, interested in nanoparticle, silver impregnated nanoparticle technology and drugs. But this is not the answer always. Your kid may not be interested, or this may not be feasible in that setup. Yes, be flexible. You also can have some other topics which may be actually maybe giving better results in the future than your so-called first research or a first research idea. Now you see, unraveling the therapeutic effects of mesenchymal cells in asthma. We know asthma. This is the research problem. We have got lot of treatments, areas of research. But what I want to do is stem cell therapy in asthma, therapeutic effects, unraveling the therapeutic effects of mesenchymal stem cells in asthma. That the student may be interested. Is the guide interested in this mesenchymal stem cell therapy in asthma? Attributes of a good research. It is based on the work of others and it should show continuity, some sort of a continuity in research work. Now I am doing something. After that, there is no continuity at all. It is all finished. That's all. Means it's not what. It should be based on somewhat on the work of others. Yes, the work of others may be some disease, for example, the cancer of the throat or something like that, with relation to gutka. This is about the based on the other work. Now what I am going to check is about the gutka's content of nicotine, or the gutka's content and the progress of the disease, or something like I want to scrap up the mucosa and then check for any dysplastic epithelium after the gutka, and how many years of gutka, number of years of gutka, all these things. Yes, somebody has done some work and we are going, and then later on some other work may continue. This is about the attributes of a good research. It can be replicated and doable. It is generalizable to other settings. It is based on some logical rationale. Yes, because I have already told, cigarettes can cause some sort of epithelial changes and they are more prone for cancers. There should be some logical rationale tied to theory in a way that it has got the potential to suggest directions for future research. It generates new questions. That is what is future research. It is incremental. It addresses directly or indirectly some real problem in the world. That is what is very important. A social problem or a psychiatric problem, whatever it is. For example, depression and smokers, depression and diabetes. It's a real problem in the world. So it addresses this. A research should address directly or indirectly this problem. It's an unrelated thing. We cannot go on to do research. It clearly states the construction ideas to be examined, valid and verifiable, such that whatever you conclude on the basis of our findings is correct, can be verified by you and others. Now, we have done a study. We have done liver function test at 27 weeks of gestation for around 500 females who are asymptomatic, and we have found less than 1% have some mild abnormality. Absolutely, there is no abnormality at all. So now we are going to put up in the paper, research paper, that there is no need for routine LFT. Understand? I put up a question: is there a need? It just throws out some questions. Is there a need for routine liver function test in pregnancy? The researcher is sincerely interested or invested in research. Now, points to consider: relevance, avoidance of duplication. Okay, you cannot go on. For example, some things, if you go to opposite shop, they will duplicate here and there, they will change, check for plagiarism, and then give it as a bound book. So this is not at all acceptable. Feasibility, political acceptability, applicability, urgency of data, ethical acceptability. All these things have to be considered. But again, now you see, diabetes mellitus is a research problem. It's a big problem. Now, what we think is, if you sleep well, the diabetes is more controlled. The sugars are more controlled. It's a basic concept which we practice. But what we going to this thing is retinal receptor potential in the dark. Now in the dark, we have a diabetes patient or a normal patient. Is there any change in the receptor potential? Is there any change in the receptor action? Is it throwing again electrical activity? Is it linked? Because the fellow is awake till 1 a.m. and reading something, his diabetes becomes uncontrolled. Is there a link? So this is what is called a research problem. Yeah. Then you go to a focus on something. Now normally it is what is called, you say, is friends. What is this friends? Feasibility, relevancy, interest, ethical, narrow, discipline specific. That should be a good supervisor. Almost we have covered many things in this, but this is an overall expression of what I want to say today. Now, feasibility means manpower. Do you have the adequate manpower to do it? Because I was given one topic and I was supposed to go to this CIDRF lab daily for 2 hours. I don't have the manpower to go to CIDRF lab. So, unless we have the manpower, yes, CIDRF. One fellow I have done. So CIDRF, I'm going there. So that means it is manpower is there. Time frame, okay. I am going to analyze the effect of some fenugreek seeds over diabetic control for the next 12 years. Is it useful? 12 years, everything is going to change. Financial, yes, entropy. Entropy, we are going to assess the depth of anesthesia. But the entropy cost is around 30,000, 40,000. Who is going to bear it? Is it funded? All these things have to be significantly analyzed before selecting your topic. There are two things in equipment. Number one, the cost of the equipment. Yes, we have to pay something, 50,000, 5 lakhs, 10 lakhs to get the equipment first. And the problem is, after 50 cases, 100 cases we have to do, 50 cases, the equipment goes off. There is a problem in the equipment. The biomedical engineer tells that this equipment will get repaired only after 6 months. We are finished. So these are all the things. whether this equipment usage is feasible, the equipment purchase is feasible, all these things, and that to researchers' capability. That is very important. Researchers' capability is very important. He is not capable to do big funda, then there is no point in giving them that big funda as a game. Now, relevance, scientific relevance, practical, social, personal, there should be some relevant in your topic. We cannot go on. So this is a very simple example I tell you. Can you prepare a vaccine for smallpox now? Already it is eliminated. No, I am going to, yes, I am going to involve in the biotech lab and I am going to invent a polio vaccine. What is there? There is no scientific relevance. What is interesting? You should have the curiosity for this. And the topic itself has to throw some light, has to just sparkle on your brain, and whoever reads the topic, yes, the curiosity, it should enthuse on the readers, on the listeners. Ethical, yes, human and animal and code of ethics. Now in humans, yes, we cannot, yes, I am going to inject some drug in the intravenous and I am going to do a sural nerve biopsy there and find out. And I am going to inject saline in some patients and then do a sural nerve biopsy. It's not possible, no. You cannot do an intervention of sural nerve biopsy in a patient and on a person, whatever it is. In animals, now the rat is there, the tail is there. Now what I am going to want to study is, if you cut the rat tail, there are a lot of pain for the rat. That is because at the end of cutting the rat, there are a lot of pain producing substances secreted. What I am going to do, the rat is, I am not going to cut the tail. I am going to inject this thing. Is it okay for the rat? So that is what is the problem. Yes, yes, is it cutting the tail, all these things, yes. The ethical animal concerns arise. Narrow, it should be focused and specific. That is what I told. Retinal receptor potential in control of diabetes mellitus. It should be focused and specific. You cannot go on comparison of eyes of both eyes and diabetes control and along with all these things. There is no focus. There is no specificity. Discipline specific. Yes, I am in anesthesia. I am interested in physiology. So I thought I will do something in physiology in the neuromuscular junction or in the actin troponin or something like that. Actin myosin complexes or in the cerebral apoptosis on age. And if I am going to lick the drug beta blocker, cognitism, and also in patients with Parkinson's disease, yes, this becomes totally absurd. Yes, because the related discipline is physiology, you are going to link pathology, you are going to link pharmacology, general medicine, neurology. Yes, this slowly goes out and it becomes unfocused. Supervisor, yes, it is important to have the knowledge, because if I am going to the supervisor or guide, I am not that knowledgeable first. I am a managerial fellow. I give this work to somebody, I give to this work to somebody. So all these people know their work and I will finish the thing. So knowledge of the supervisor is important. His interest, his involvement on the study, on the research work of the researcher is very important. Yes, we should have an interested, committed, knowledgeable supervisor before any research work. Now, what's the problem and the topic? You see, this is a study by me. Estimating serum vitamin D levels and assessing its influencing factors among antenatal women, South Indian town, Kumbakonam, urban, rural epidemiological study, Qs 5. This is done by us. Now you see, the problem is vitamin D level is decreasing in antenatal women. We need to supplement. But in antenatal women, because of the decrease in vitamin D, what all happens? So we have found out here in the influencing factors, the main influencing factors is what we have found out is religion. Already it is dipped, and in Muslims it's more than 3 times than Hindus. So for example, the normal value of vitamin T in Hindu is around 16, while it is around 12 or 9 10 in Muslims. So there is a big variation. So this is what we have established in this. So problem is vitamin D, pregnancy, increased risk of abortion. Now we are going to influencing factors. This is all about the problem and the topic. Now we will go to the research title. Title is very important. We know the topic, but slightly you have to adjust the words in the topic. That is what is called title. It should be descriptive, yes. It should be direct, it should not be indirect. Accurate, appropriate, and interesting. It should be concise, precise, unique. Should not be misleading. See here, concise are going to descriptive, precise, accurate. All these things. See all these jargons like yes, but what is more important is now you see this is our study. Estimation of thyroid stimulating hormone level in the normal college female student in a semi-urban Indian town, Kumbakonam Urban Rural Epidemiological Study, Q7. It is done by us. See here, it is quite big, but it is not focused like. We don't know what is actually there. College female college students in Udaputta. All these things come now. TSH levels in normal college female college students in a semi-urban Indian town. Is it necessary? All these things puts this topic as our title little vague. If you want to go above, it is not precise. Now I will show you with one more example. Comparison of manual uterine displacement with wedge as a prophylactic measure for intraoperative hypotension in elective cesarean section along with co-loading and leg wrapping, a randomized clinical trial. Yeah, nothing can be understood. So big a title, comparison of manual uterine displacement. So this is the this is keeping a wedge. After giving spinal, you keep a wedge. Or manual you push so that your inferior vena cava is not compressed by the baby. So the BP does not fall after spinal anesthesia. So now you can, this is the leg wrapping. Leg is wrapped so that the BP, your blood flow is pushed like this. So your BP does not fall after anesthesia. So this, if you want to refine it, now you see what is my paper about. It is about manual uterine displacement be better than mechanical randomized trial. Women undergoing cesarean section under spinal, co-loading, leg wrapping. If you want to keywords, pelvic wedge, BP fall, hypotension, spinal anesthesia. If you want to combine all these list of keywords and put a title, previously we have found title. Can manual uterine displacement be better than pelvic wedge in preventing hypotension under spinal anesthesia? In patients undergoing elective cesarean section with co-loading and leg wrapping and randomized trials. We have got 28 words. Normally it is better to have between 10 to 15. So we want big change in this. Now can I remove panilla? Yes, remove. Be better than remove. Patients remove undergoing. Now you see comparison of manual uterine displacement and pelvic wedge in preventing hypotension under spinal anesthesia. This is 23. We have removed certain things. Randomized trial we have removed. Now you see, manual uterine kayala just and the push versus a mechanical wedge in preventing hypotension under spinal anesthesia and elective cesarean section. It's very simple. 14 words only. You see, it is substantive words. There's an interesting word, substantive. So these words should be really to the point, precise. And you to take only 14 words. From 28, 23, we have come down to 14. Now what we have told, comparison of manual uterine displacement with wedge as a prophylactic measure for intraoperative hypotension in elective cesarean section. See, now manual uterine versus pelvic edge in preventing hypotension. See the difference between the original title and this title. So it indicates accuracy of the subject and scope of the study. 10 to 15. You should not use abbreviations. Create a positive impression and stimulate the reader interest. For example, now we have an article. Smooth extubation. Does morphine need a comeback? Continuous spinal anesthesia. Does this technique needs a relook? All these things is just some stimulation in reader interest. It creates a positive impression. There is one drug called Entonox. If you inhale it, you will have less labor pain. So the resurgence of Entonox. It's not about Entonox. The word is about resurgence of Entonox. Means it creates a positive impression and it stimulates reader interest. Use current nomenclature from the field of study. Key variables, it may be dependent or independent. Suggest a relationship between variables which supports the major hypothesis. Do not include study of analysis, need not be added. But you have to suggest a relationship between variables which supports the major hypothesis. Is there a difference in writing the title for a research paper for publication? Because for publication, if you are sending, the journal will have some rules. We have to follow that. No title should be more than 15 words. The title should not contain randomized type of trials. The title should contain randomized trials. All these things will be there for that journal. So research paper cannot be equated for a title of a PhD thesis. Now, research paper. What is my paper about? Use of fentanyl or dexmed. There are two drugs to attenuate or decrease the BP response during extubation. After anesthesia, we take out the tube. Just before that, we give either fentanyl or dexmedetomidine, two drugs. Why we are giving these drugs? To decrease the BP surge, hemodynamic balance. So randomized controlled double-blinded study. Who it studied? Patient undergoing general anesthesia. What were the results? Both were equivocal with no major difference. Now, what's the constructed title? Rapid, reliable, smooth extubation. Anesthesia is coming out. It's very smooth. When comparison of fentanyl and dexmedetomidine. This is what is the constructed title. Now we can, it just rapid and reliable, smooth extubation means it creates interest. It is somewhat, it creates a positive mood like to the person who reads this. So this is very important. The title should not include Roman numerals. Try not to include semicolons. However, colons may be used. Subtitle can be used. Now there is a European Journal of Anesthesia. See example 1. Effects of perioperative intravenous low-dose ketamine on postoperative analgesia in children. It is very hazy. It is not focused. Now you see that low-dose ketamine fails to improve pain relief following urological surgery in children below 6 years, a randomized trial. See, these are the same topic. But you see here, low-dose ketamine. This is what is the positive impression. Means they are very interested about reading this rather than this. That is how a title should be. Now you see utility of 18G fluorodeoxy PET scan in detecting bone marrow involvement in lymphoma. 8 of the PET scan, CT scan in detecting bone marrow involvement. Utility. If you want to see the use of 18-fenflon in detecting bone marrow involvement in patients with lymphoma, a feasibility study. Yes, this title can also be like this. But it is very simple, concise, but also to the point. It is focused, still it is descriptive. That is how a title should be there in PhD thesis. It can also, that's what I told, it can also include how a variable is related to the main thing. So for example, an outcome measure. For example, a pain relief. What is the variable? Pain relief. So for pain relief is the main thing. So the other variable is a big patient, a use of tramadol, or the patient, pregnant patient may have received some tramadol. All these things are variables, how they are correlated. This is one. Now you see, papillary thyroid carcinoma, cervical lymph node metastasis, correlation analysis of nodular sonographic parameters. So nodular sonographic parameters, if there are there, and if you do a biopsy later of that node, yes, they are correlating. This is what is the study is about. Yes, it is so clear, concise, to the point, and yes, it is new, and it also puts a lot of research questions after the results. Now to summarize, identification of a research problem, already we have told big research problem is a PCOD, infertility. What is it? What are you going to do in that? Yes, this is about the research problem. Selection of a research topic. I am going to do only yoga exercise for decreasing the incidence of PCOD. So selection of a topic. How to write a research title? Yes, research title, a comparative evaluation of. Yes, you can write like that. Or breathing exercises versus yoga in decreasing symptoms of PCOD in patients presenting with infertility. Something like that. So research title, yes, it is focused. It puts a point very concise. It is also descriptive. Yes, always remember, friends, feasibility, relevance, all these things I have already told, interest, ethics, narrow down, discipline, and focus to the discipline and the supervisor. Thank you.